30 heart attack signs you might be ignoring. 1. Persistent cough. A cough that doesn't seem to go away, particularly if it worsens at night or produces pink or white mucus, could be a sign of heart disease. Such a condition suggests that the heart is struggling to pump blood efficiently, causing fluid to back up into the lungs. 2. Dizziness. Experiencing dizziness without a clear cause might signal an underlying heart issue. While dehydration, low blood sugar, or malnutrition are common culprits, frequent, unexplained dizziness could point to a heart problem. Early detection of such symptoms can help prevent severe heart conditions. 3. Fatigue. Persistent fatigue that cannot be attributed to physical exertion or lack of sleep could indicate a reduction in the heart's ability to pump blood effectively. This symptom often results in excessive tiredness and an overwhelming need for rest. 4. Sleep disorders. Chronic sleep disturbances, particularly those paired with breathing difficulties, chest pain, or palpitations, may point to a heart condition. If sleeplessness persists and aligns with these signs, consulting a healthcare professional is crucial. 5. Rapid weight gain. Unexpected and sudden weight gain might indicate fluid retention caused by heart issues. This symptom often leads to bloating and swelling. Monitoring weight changes will give you a better insight into what's happening with your cardiovascular system. 6. Cold sweats. Sweating excessively without physical activity can be a sign of heart trouble. This occurs when the heart struggles to pump blood through constricted arteries. 7. Irregular heartbeat. While an irregular or racing heartbeat can occur due to excitement or adrenaline, frequent irregularities might indicate arrhythmia. This condition can increase the risk of stroke if left untreated. Early diagnosis is essential for proper management. 8. Unconsciousness. Fainting or passing out can occur when there is a sudden drop in blood pressure or insufficient oxygen in the bloodstream. These episodes may indicate heart problems, such as arrhythmias. 9. Nausea and loss of appetite. Heart issues can manifest as gastrointestinal symptoms, including nausea, bloating, or a sudden loss of appetite. While these signs can be mistaken for digestive problems, they may signal more severe concerns and should be evaluated by a doctor. 10. Gum inflammation. Bleeding or swollen gums could be an indicator of heart trouble. The bacteria from inflamed gums can enter the bloodstream, contributing to clots and other cardiovascular issues. Maintaining oral hygiene is essential for heart health. 11. Persistent snoring. Snoring might be more than just a nighttime annoyance. If it's accompanied by unusual sounds or pauses in breathing, it could indicate sleep apnea, a condition linked to heart problem. Pay attention to your own snoring or that of your partner and consult a doctor if this issue arises. Treatments are available to address the underlying causes and prevent further complications. 12. Pain in the upper body and arms. Unexplained pain in your arms and shoulders could be a signal from your heart. During a heart attack, pain often originates in the chest and radiates to these regions. 13. Bloody or pink-tinted mucus. Producing mucus tinged with blood or a pink color could suggest fluid buildup in the lungs, a possible sign of heart disease. If you notice this change in your mucus, schedule an appointment with your healthcare provider to investigate the cause and receive appropriate treatment. 14. Frequent nocturnal urination. If you frequently wake up during the night to urinate, even without consuming fluids before bed, it may indicate heart failure. This symptom often stems from fluid buildup and kidney involvement. 15. Cramps in the buttocks or thighs. Pain or cramps in your thighs, calves, or buttocks while walking might not always be due to a lack of magnesium. These symptoms can sometimes point to a circulatory issue known as aortoiliac occlusive disease. 16. Smooth, hairless legs. Noticeably smooth and hairless legs may be more than a cosmetic concern. This could be a result of impaired blood circulation due to peripheral artery disease, PAD. If you observe these changes, along with cool or shiny skin on your legs, consult a healthcare professional. 17. Chest tightness and burning sensations. Unusual sensations like heartburn, tightness, or fullness in the chest area should raise alarms. These symptoms can indicate an impending heart attack and require immediate medical attention. Don't delay. Call emergency services if you experience these symptoms. 18. Erectile dysfunction. Difficulty achieving or maintaining an erection could be a subtle sign of blocked arteries affecting blood flow. While this condition has various causes, it's essential to consider potential cardiac issues. 19. Episodes of panic or anxiety. Panic attacks, often mistaken for heart attacks, can exhibit similar symptoms, such as chest tightness, sweating, dizziness, and heart palpitations. 20. Mental confusion and memory issues. Difficulty concentrating, memory lapses, or sudden confusion could be tied to heart failure. Chemical imbalances in the blood, particularly sodium fluctuations, may play a role. 21. Severe and sudden migraines. Sudden, intense migraines, particularly if accompanied by dizziness or vomiting, may suggest a potential stroke or blood clot in the heart. Immediate medical attention is critical. 22. Persistent leg and foot swelling. Have you noticed your legs or feet becoming unusually swollen without a clear cause? This could signal fluid buildup in the body, possibly linked to heart issues. Such swelling, or edema, often affects the legs and feet, most due to their distance from the heart. 23. Persistent jaw pain. Unexplained pain or discomfort in the jaw, especially if it radiates from the chest or neck, might be a subtle warning of heart trouble. This symptom is more common in women and can sometimes indicate a heart attack. 24. Changes in nail appearance. Clubbing of the fingernails, where nails curve abnormally over the fingertips, may indicate low oxygen levels in the blood due to heart or lung conditions. 25. Dark circles under the eyes. While often attributed to lack of sleep, dark circles could sometimes indicate insufficient oxygenation in the blood, which can be linked to heart or circulatory issues. Pay attention if this symptom appears alongside fatigue or breathlessness. 26. Cold hands and feet. Consistently cold extremities could be a sign of poor blood circulation, potentially linked to heart problems or peripheral artery disease. Pay attention if this condition worsens or is accompanied by numbness or discoloration. 27. Frequent yawning during physical activity. If you find yourself yawning excessively during workouts or light physical activity, it could signal an issue with your heart's ability to pump oxygen-rich blood efficiently. This unusual symptom is worth mentioning to a healthcare professional, especially if accompanied by fatigue or shortness of breath. 28. Persistent hiccups. While hiccups are typically harmless, chronic or prolonged bouts might point to irritation of the phrenic nerve, which can sometimes result from heart problems, including pericarditis. If persistent hiccups occur alongside other symptoms like chest pain or shortness of breath, seek medical advice. 29. Blue-tinged lips. A bluish tint in the lips can indicate a lack of oxygen in the blood, often caused by poor circulation or heart-related issues. This symptom is a red flag for underlying cardiovascular problems. 30. Blue or purple toes. If your toes take on a bluish or purplish hue, this could indicate poor blood circulation caused by a heart condition. Known as peripheral cyanosis, it happens when there isn't enough oxygen in the blood reaching your extremities.